Greetings, everyone. It is a little bit of a cool July morning here in southeast Georgia. Looks pretty clear. Couple clouds on the horizon, but nothing overhead. So it's pretty nice, pretty clear. It's going to be sunny today. It's going to get warm again here on the coast. I'm doing pretty fine right now. Big thing on my mind when it comes to this, at least, is the rescission bill passing the Senate yesterday. They did put in an amendment for PEPFAR, which is the basically the funding to help with kids with AIDS. But there's still rescissions, obviously, about $1 billion for PBS and NPR, which funds local stations and really is the only way that a lot of the really great reporting and programming happens for people in more rural areas like where I live. You know, I don't live on a big metro area in Georgia. And then in addition, the other $9 or so billion, or sorry, not nine, I can't do math. The other $8 or so billion that is going towards aid. It's going towards refugee facilities. It's going towards promoting goodwill across the world for America. So it is an arm of soft power, which you can argue whether that's good or bad. I would say it's good. I would rather have peace and what's the word I'm looking for? Peace and humanitarian initiatives and efforts be the thing that that people across the world think of when the word America comes to their mind, and not hard power, which means rolling tanks down your streets, bombing your cities, and parking aircraft carriers at your port or near your ports to devastate your life. So that's my mentality of soft versus hard power. I would rather as much be a soft power nation, which other nations are doing a lot more successfully than us. So, but yeah, we should be running or a couple minutes into the Marketplace Morning Report. So let's jump into that.
All those other tech titans wouldn't be what they are without TSMC, says Mike Schmidt of Princeton, who administered the CHIPS Act in the Biden administration.
Every Apple iPhone, every NVIDIA AI chip runs on TSMC's technology.
Schmidt says making the chips rather than designing them was a decision the firm made decades ago, and it was a good one.
What that meant was they developed a huge amount of expertise and ultimately scale in manufacturing.
That let their customers, like NVIDIA, focus on chip design without needing their own factories. Lawmakers have approved billions in funding to bring more of TSMC's factories here to the US, but achieving the scale it has back in Taiwan won't be easy.
It's not just about one company moving to the US.
Dan Ives, analyst with Wedbush Securities, says a lot of the firm's suppliers are still across the Pacific.
You have, when it comes to the inner workings of the supply chain, 60, 70 partners when you actually go downstream involved in the process.
Ives also says the US just doesn't have enough of the skilled workers to staff these advanced chip factories. I'm Daniel Ackerman for Marketplace.
All right, let's do the numbers. The FTSE in London is pretty much flat now.
Yeah, there is a certain level of technical expertise that's required, to run these large industrial factories, right? I mean, you could definitely train a group of people to get there, but if you want people to, build one of these manufacturing plants and then jump right into it, it's not going to run very successfully unless you get outside help. Sorry, I got a weight in my truck that I used to weigh down a cardboard when I'm taking it to a recycling center. Where was I? You're going to have to bring outside help, and that outside help is going to be coming from a foreign nation. So, seeing how loving our current administration is to people from outside the U.S. coming in to work, I don't think that's going to be very successful anytime soon, unless there's some good deals made. But even then, they still might get terrorized by our police system, our federal police system.
AFF Health News reports.
Congress and President Trump are spending billions of dollars to make rural America healthier. But will the $50 billion fund work?
Like an investment of this amount and this style into rural, hopefully it goes to rural.
Sarah Holman is at the National Association of Rural Health Clinics.
God dang.
And yeah, she's
People are going 90 down the highway.
You know, I think there's just some like confusion about who actually gets this money at the end of the day. Like what is it actually going to be used for?
Holman's organization represents nearly 6,000 rural health clinics, where more than a quarter of patients use Medicaid for their health care. The new bucket of money amounts to $10 billion annually for the next 5 years under the federal umbrella of the Rural Health Transformation Program. The funding goes to the states, but the way it's going to be distributed is a big unknown.
As long as it's a government slush fund.
That's Michael Cannon at the Cato Institute.
Where politics decides where the money goes, then there's going to be a mismatch between where those funds go and what it is that consumers need.
When Cannon says consumers, what he means is patients in rural America. The program is designed to invest in things like workforce recruitment and boosting health outcomes. Rural people die younger on average and live with more chronic diseases. It's more common in rural areas for labor and delivery units to close, or entire hospitals to close.
Yep.
Some policy watchers say that the silver lining from this new program isn't enough. The big law that it's part of slashes federal spending on health programs. Fred Blavin, a senior fellow at the Urban Institute, dove into the numbers.
These huge cuts in the program are going to translate into millions of people losing their health insurance coverage. These dollar amounts translate to actual people.
The nonpartisan Congressional Budget Office reviews how much laws will cost. Over roughly the next decade, the law will cut about $1 trillion from federal Medicaid spending.
Jesus Christ.
And rural America has more people on Medicaid than any other part of the country. In Washington, D.C., I'm Sarah Jane Tribble.
Our executive producer is Nancy.
Yeah, it's going to mostly hurt people in rural America. The reconciliation bill that just passed the week before last, it's mostly going to hurt rural Americans who rely on these programs because there is no medical facility where they live, or the closest hospital is, hours away. So there's these Medicaid and Medicare funded facilities that are small, but the only way they do, provide the services that they provide is because of federal support, which is distributed by the states. And since all that money is going away, all of those facilities are going to go away, and we're going to see a lot more people dying a lot younger from very much treatable diseases. And people who get hurt doing their jobs, which is going to be very labor intensive. I mean, it's kind of just how it is when you live out there. They're going to get injured, and they're not going to be able to get health care for it, and they're going to live in suffering for the rest of their lives, or potentially up to the rest of their lives, and that's just unacceptable. We're better than that. We're better than that as a nation. There's no reason we should let our brothers and sisters across this country suffer unnecessarily just so we can, have the ultra powerful become more powerful and get more money. It's just ridiculous. Me saving a couple $1,000s in taxes is not worth someone else suffering for the rest of their life. That's just how I see it.
I'm unhappy with the Republican stance on things. The current administration has alienated our allies, has turned the clock back to the United States years and years and years, and I don't know how long it's going to take to get that momentum back.
And in Athens, protester Michael Call said he wanted to attend the event to honor Congressman Lewis.
I was a little boy when I first saw him, and the way that he spoke, it inspired me to always keep up the fight. Having him as that leader made me want to do more.
You're listening to GPB.
Live from NPR News in Washington, I'm Janine Herbst. The House last night voted to take back $9 billion in already approved federal funding for foreign aid and public media. President Trump is expected to sign the bill soon. The vote was along party lines. Republican Steve Scalise.
Getting spending under control. Does it answer all the problems? No. $9 billion, I would say, is a good start. And hopefully we do more things like this.
The Democratic House Whip Hakeem Jeffrey says
I'd rather cut $1 trillion from
undermine the ability
defense contractors
of people in rural America and in small town America to receive advance warning or necessary information when disaster strikes.
The bulk of the money, around $8 billion, was allocated to foreign assistance programs, and $1.1 billion was for the Corporation for Public Broadcasting, which funds NPR, PBS, and their member stations. President Trump is threatening to sue the Wall Street Journal and its owner for publishing an article linking him to convicted sex offender Jeffrey Epstein.
There's
As
pictures of them together.
Reports, the Journal obtained a letter allegedly sent by Trump to Epstein for his 50th birthday.
In a Truth Social post, Trump said the Wall Street Journal was told directly by Caroline Leavitt and by President Trump that the letter was a fake. Later, Trump also said in a post he asked Attorney General Pam Bondi to produce, quote, any and all pertinent grand jury testimony in Epstein's case. For more than a week, Trump has faced controversy over the so-called Epstein files that Trump once told his supporters he would release, then his administration said didn't exist, and that he now falsely claims is a, quote, hoax pushed by Democrats and, quote, stupid Republicans. Stephen Fowler, NPR News.
In a social media post, Attorney General Pam Bondi said she will ask the court to unseal some of the grand jury transcripts. A new analysis projects the cost of health insurance will spike next year for people in the U.S. who buy their own plans. NPR's Selena Simmons-Duffin has more.
There's one big reason why insurance premiums are going up next year. The federal money that had been making premiums lower expires in December. Those enhanced premium tax credits began during the pandemic. Cynthia Cox is with KFF, the nonpartisan health research organization that published the analysis of next year's rates.
Individuals on average are going to pay 75% more than they did this year.
People who are generally healthy might well decide that's not worth it. They'll go without health insurance and risk it. The people who can't do that tend to have chronic conditions or expensive medications, which cost insurance companies more. Cox says that's why health insurance companies are raising rates. Selena Simmons-Duffin, NPR News.
U.S. futures contracts are trading flat at this hour. You're listening to NPR News from Washington. Meta investors and company CEO Mark Zuckerberg have agreed to settle a lawsuit currently being tried in Delaware. NPR's John Ruwitch reports the case stems from the Cambridge Analytical data scandal.
Investors sued Zuckerberg and other senior executives with what was then Facebook, now Meta. They were seeking more than $8 billion in damages linked to fines and legal costs that Meta incurred after the Cambridge Analytica data breach. Facebook paid a record $5 billion fine to the Federal Trade Commission after being accused of violating user privacy agreements. The bench trial started on Wednesday in Delaware and was slated to last about a week, but on Thursday morning, lawyers for the investors notified the judge that the two sides had reached a settlement in principle, according to a copy of the court document. The details of the settlement are not yet known. Attorneys from both parties could not be reached for comment. John Ruwitch, NPR News.
Meta is a financial supporter of NPR. There's a thief afoot in the Grand Teton National Park. The bounty? Shoes. The National Park Service put a post.
Gonna have to cut it short again. It's just this week it's been bad with the radio, and it's probably gonna get worse now that funding is getting cut to NPR and member stations like GPB. So very, very frustrating that this is happening, and I don't know. It's just very frustrating. And then on, again, the topic of healthcare, because that was just two stories talking about healthcare getting more expensive and healthcare becoming harder to get in the first place. The thing is that, like, medical care it has inelastic demand, right? It doesn't work with market forces whatsoever. Just like the need for a fire department is not something that, like, works with normal market forces. There's no demand that changes depending on, like, the availability of supplies or something. Like, people need healthcare the same way that you need a fire department to be ready for you in case there's a fire or a medical emergency, and then they help you get to the hospital, which hopefully will still exist depending on where you live, So it doesn't make sense. Our system does not make sense unless the purpose of the system is to make as much money as possible off of people's fears of getting sick, getting hurt, and dying. Like, that's the only way this system makes sense. It's just absolutely ridiculous. So, I mean, that was really the failure of Obamacare, was that it didn't actually address the underlying issues. Yes, the Affordable Care Act expanded healthcare access to millions of Americans. The most access or expansion of access to healthcare. Oh, what the hell? What are you doing? Sorry, person in front of me. That our country had ever seen, right? But it wasn't enough. And ultimately, what it did was it provided a way to funnel more of our money into the hands of insurance companies, big corporations who make their money off of the sick and dying and the fears of people who don't want to be sick and don't want to die. But instead of paying directly, it's paying, for our normal insurance premiums and then paying for it through the government. But we still got basically the same or worse outcomes from it. So like the system itself didn't really change, with the exception of now our tax dollars are going into paying insurance premiums instead of just paying for the healthcare itself. It's just absolutely ridiculous. So if we want to see healthcare prices go down, if you as the average American want your premiums to go down, or for you to even have access to healthcare in the first place, because the premiums that maybe your job does provide, if you are lucky enough to have that, since most healthcare is through employment here in our country, if you want to see any change, the change needs to be getting rid of insurance companies. It's just not going to work the way that it currently does. And, we need a national healthcare system that serves all people, regardless of how much they make, what job they have, and what industry they work in, right? If you work in fast food as like just a kid in college or something, you aren't guaranteed access to healthcare. Like, your school might have a plan, but maybe it doesn't. Or let's say you're not even going to college because there's not a college nearby where you live. Or if it is, it's way too expensive and you're just trying to survive, Yeah, that fast food restaurant, that Denny's you're at your first job, a starter job, it's not going to pay enough, or might not even offer healthcare in the first place. So we need to revolutionize our system entirely, which it is to nationalize healthcare, to make it nationally available to everybody, and to cut out the middleman, which is health insurance. Health insurance companies and health insurance itself is a scam. It is ripping money out of your pockets and putting it into the hands of a bunch of accountants that only job is to squeeze more money out of you, and a bunch of executives whose jobs it is to tell the accountants how to squeeze the money out of you. Their purpose in life is to make money off you. It is not to provide health care. End and end. Hospitals, they provide health care. The problem is that they are profit-driven companies as well. So if they can't make money, then they'll close up shop and go somewhere else. And now a community has lost their doctors. It's absolutely ridiculous. These organizations, they should be working to provide a public good, not a commercial service. And I'll leave it at that. So I hope y'all have a good one. I hope y'all enjoy your weekend. My wife and I, we're going to be getting ready for a trip to go see family. It's funny enough, since there was just a story yesterday about how people are traveling less. This will probably be the last trip I do of the entire year. If we do have like another vacation, it's going to be camping at a local spot, like less than 10 miles away from my house. So yeah, this is like our big trip for the year, and then it's nothing after that. And probably, hopefully we get to do something next year, but we'll see. So hope y'all are able to enjoy this time. You know, it is hot, it is sunny. Make sure you drink your water, make sure you getting your electrolytes. But you know, before school comes back in here in the next month, you know, get a little bit of last second summer fun in, because it's going to be back to the grind for people who have school age kids, and for those of you in, you know, college, community college, university, it's going to be back to the grind with that as well. So I hope y'all have a good one. Hope you have a good weekend. I'll see y'all Monday.